I'm here at Six Flags because I want to introduce you to Jacob. I am told for him, this is a pretty special place.
Goliath, Twisted Cyclone.
Maybe the rides are a release. Jacob has a long list of behavioral disabilities. He's been to 11 different schools in 10 years and always seems ready for a fight. But his father, Chad, says there's just something about the rush of these rides.
As soon as we roll through the gates and we're headed to that first coaster, and we are just screaming our heads off, and I look at his face and it is drama-free. It's just me having time with my son.
Breaking things outside and trying to break in the door to come inside.
But earlier this year, that drama got to be too much. There were serious safety issues. I'll skip to the end. His parents gave up custody. Jacob is now in Southwest Georgia at a group home, his care controlled by DFACS. And his parents say there's really only one reason why: mental health parity.
You know, you get those hidden disabilities, the ones you can't see, the poor executive function skills, the ADHD, the autism. You do have to fight harder, I feel, to get coverage for those. Yeah, if he had cancer, you'd be down
or diabetes.
We'd be down at CHOA getting top-notch medical care for as long as he needed.
Amy and Chad Austin know a lot about health insurance. He works for a school district, so they're covered under the state's health benefit plan. Their son has been in therapy since he was a toddler, occupational, speech, and behavioral.
You can't even make an appointment without calling the insurance company first and getting a code that says it's okay, and then you get 20 visits.
Set number.
Hopefully you're fine at the end of those 20 visits.
Amy herself is a children's occupational therapist. She works all day with children who have intense needs, but that didn't make navigating the system any easier.
The burden of behavioral and mental health conditions in children and adolescents are significant, and they're growing. In
fact, according to Dr. Daniel SALINAS of Children's Healthcare of Atlanta, in the past 5 years, that burden has shot up more than 130%.
Some kids present to us with severe aggression.
Stop.
Dr. SALINAS is talking about children like this boy, Bradley.
And these are kids that may have a condition where once they get anxious and the anxiety builds and they spiral.
The hospital's data shows transferring a kid with a behavioral or mental health need takes 3.5 times longer than transferring one with a medical problem like severe burns.
There may not be a place yet that can accept them because they don't have the special expertise, but developing that expertise in these facilities sometimes comes down to parity.
Just as frustrating, of the patients transferred to a psychiatric setting last year, more than 10% were back in the ER with another crisis within a month.
When you say mental health parity, people's eyes kind of glaze over.
That's Eve Bird, the executive director of the mental health program at the Carter Center. She says not all insurance companies are required to provide coverage for mental health. But if they do, they must provide it at the same level as physical care. And in the case of Medicaid, access to care is a mandate. It sounds like we're not meeting that mandate.
We have no transparency and we're not enforcing it. People continue to have to pay much more out of pocket for their mental health treatment. People are unable to get or identify providers.
He needs to marinate in therapy where everything's a teachable moment, but how do you get him into a place like that?
Fearing their son would lose access to treatment, Jacob's parents pressed charges for things like destruction of property, theft, and use of drugs and alcohol. The hope was the juvenile court judge would order him to therapy instead of jail. But when they started down that road, they had no idea it would come with a catch.
You got to give up custody. And we're like, I'm miffed about that. She's livid over it.
I'm furious.
I can't believe. Nobody pays attention until there's a crisis.
911.
You guys have been out here on a couple of previous occasions. It's about to get out of hand.
And then in the crisis, people go, well, why didn't you get help before that? Well, nobody was listening before that.
Let's pause and think about that. We want the state to provide better care for these children, but it's the state's own health care plan that wanted to deny coverage for Jacob. But that means that everybody there in that circle knows that they've just removed custody for the sole purpose of getting him care.
Yes.
That's a tough concept for Jacob, a teenager who doesn't know what to do with his emotions, but does know he loves his parents. And he needs to know that he is loved too.
He broke down completely. He sobbed. He cried and cried and cried and cried. And he's like, does this mean you don't want me anymore?
It is an emotional roller coaster kids just shouldn't have to endure.
Why is Georgia forcing families to do this? This to me is a dirty little secret. Why is it, if the money is there, why are we forcing parents to give up custody?
He's a really neat kid, and I miss that.